title of the talk is A Surgeon's Perspective about Libby. Surgeons are a different type of doctor. We're the blue collar guys. We're known for not being super cerebral, but we're known for being pretty practical. And if I had to write a story about Libby, I would entitle the story The Injustice of Truth Telling. How did I first find out about Libby? This was back in the early 2000s. I was working as a surgeon at Memorial Sloan Kettering in New York City, and I had a patient who had mesothelioma. And I did this big aggressive surgery on them. It's called an extrapleural pneumonectomy, and it's where you resect the entire lung, the lining of the lung, the lining of the heart, and the diaphragm, which is the muscle between your chest and your belly. And you take all this out, and this is after a big incision on your side like this. And most of the patients that undergo that surgery still die. And it is a surgery done for a disease that is preventable. And this one patient gave me insight into Libby. She told me, yeah, there's this place, Libby, Montana, where the mesothelioma and the lung cancer is through the roof. And she actually gave me a book about it. So I sat there and I read this book. And what I realized, for those outside of Libby, if they have heard of Libby, they think of Libby as a cancer-causing town. They don't know about the other stuff. So as I started getting more and more experience, I started learning about it, and I learned about this guy named Selikoff. Selikoff was this investigator who connected getting mesothelioma, the cancer, with asbestos exposure. And this doctor was at Mount Sinai, and I got offered this new job at Mount Sinai. So I took it, and I've been there for the past 15 years. And while I was working there, I met this other researcher called Steve Levin. And Steve Levin had been coming out here and doing work with Brad Black. And he would have me look at the films and talk to me about the diseases that they were seeing here. He also got me involved with the insulators. Like I said, surgeons are typically the blue-collar guys of medicine. So I worked with the insulators and the people who were predisposed to getting this. And then Steve introduced me to Brad Black. And so I was curious to see what was going on in this little town of Libby. And the reason why I was so intrigued with meeting Dr. Black is because he was in the trenches, right? You've got researchers that frequently will talk the talk, but here's this guy that was walking the walk. And so I looked at the scans, I saw some patients, I heard their stories, and then he took me around. I went up to the Libby Dam, I saw the mines, I saw the baseball fields, I heard the stories about the fairy dust coming down. Such a benign, kid-friendly sounding thing, fairy dust. Deadlier than any war you're gonna have. And it gets promoted as fairy dust, which just got to me when I heard that. But the most eye-opening moment that I had this was about 7-8 years ago. There was this town meeting at Card where I got to meet a lot of the people like you hear. People who had nasal prongs hanging from their nose, wheeling around an oxygen tank with them. And I heard them talk about their stories, about their family members who had died, about what was happening to them and how they wanted to make sure that they provide for their families, knowing that their time was limited. And, you know, as a doctor, we take this oath. And in the oath that we take, this Hippocratic oath, it says, I will prevent disease when possible, because prevention is preferable to cure. And after I saw what was in Libby, I can't unsee it. God has put this in my path. And so it is not just up to me as a doctor to treat the patients that come down with this, but it's my job as a doctor to spread the word so that people understand what is going on here. And the best cure for the diseases that you see here is to prevent them, to never let them happen. You want to talk about the research? From what I looked at, Sullivan had published back in 2007 that in Libby, they get twice the rate of lung cancer as the general population, 23 times pleural disease, mesothelioma, 165 times the death from asbestos-related diseases. That's the data that's out there. And what Selikoff said, the guy from Mount Sinai, is he said statistics are patients with the tears wiped away. I see the tears. I see them every day. I see those patients in front of me suffering from this. And when I come to Libby, I see these diseases that are being downplayed. The little tiny lamellar thickening that Dr. Zainuk showed you, when that's associated with a patient who can't breathe, who's having chest pain, and meanwhile, they get you on a technicality to discredit you, that's an injustice. That is wrong. And it is an injustice that they have closed that card clinic, which was essential to the people of Libby. But the injustice to cards can't compare with the injustice to the people of this town. And what it's important to know is that this is done not by people who have credibility. It is done by people who have other interests. So another injustice that you should know about is that in Congress, they have been fighting getting asbestos banned in the United States. It was just in the papers the past couple of days. And everybody knows asbestos causes cancer. Asbestos kills you. And they have had trouble getting it passed. You know, when you had the Grace Commission back in the 80s, that's like putting the fox in charge of the hen house. The Grace Commission was in charge of keeping you safe. And so that's important to understand. There are a lot of forces that are keeping asbestos from being banned in the United States. I didn't know this. I had already been operating on asbestos patients for over a decade until I found that out. So I think most of the community knows that asbestos, thinks or believes that asbestos is banned in the United States when it's not. So there's a lot of misinformation that's out there, and it was out there before the internet, before social media, very carefully placed misinformation that benefits what I want to call big asbestos. And that is what's going on in towns like Libby. So what can you do? What you guys are doing, speaking up, coming out here and getting educated on the subject. And I just want to end by talking about a saying that I saw when I was at that town meeting years ago. And it was a saying by Margaret Mead that said, "Never doubt that a group of small, dedicated people can change the world. Indeed, that is the only thing that ever has." So I give Libby and the team here credit for their courage, because whenever you say a truth that is not in agreement with the big people out there, you're going to get harmed. And just keep telling the truth and keep swinging.